Good morning, everyone. Welcome to TeleShadowing. We are live on YouTube. Please feel free to ask questions in the chat box as we go along and they'll be addressed. I'm honored to introduce our mentor for today, Dr. Chima. Dr. Chima is an accomplished internist. She's an attending physician affiliated with the University of Maryland Medical System and teaches residents and medical school students. She completed her internal medicine residency at the University of South Florida. She's a mentor to students and a published author in neuroendocrine tumors and infectious diseases. Dr. Chima participates in community services and believes in health for all. She's also running a clinic for low-resource patients. And now it is my honor to request Dr. Chima to begin today's session. Thank you.
Thank you, Hamza. I really appreciate it. Very good morning, everyone. It's an honor to be with you this Saturday morning to share a few thoughts with you. And I would like this session to be more interactive and need your participation. This is a time for learning and try to answer the questions, best of your ability, and participate actively. This is a time, so utilize this time more productive. So have a good productive, this time should be used that you are learning something actively. So that's why I need your participation. So during this session, we will discuss one case study, and then we have a student panel. They'll discuss about interview skills. And before we start a session, I would like to go over self-care again, as I do in my prior sessions as well. So again, every time I start, I say, what is self-care? So I will go pretty quick. So ask yourself these questions. Are we happy about our health? Do we have a good appetite? Do we have a good, comfortable sleep hours? What gives you energy? What drains you? And do we perform workout daily basis? Do we get angry very easily? Do we get upset if our opinion is rejected? What do other people think about us? Get feedback from others. And are we growing? And most importantly, are we sure about purpose of life? So these are all the questions that come in our self-care, self-awareness, and it will help us in our growth. So what is self-care? So self-care basically is a process of establishing behaviors to ensure well-being of oneself, to promote health and maintain health. It's basically the practice of taking actions to preserve or improve our own well-being, our own wealth, our own health. And as I mentioned, these questions you can ask yourself, and you can see where you stand and which areas we need to improve. And for most important question, we need to ask, why do we need self-care? So can you tell me, can anyone type in the box, why do we need self-care? Can you please go to the next slide? So let's see how many responses we get. Why do we need self-care? Let's see if we get any responses in the chat box. Okay, someone mentioned to ensure we don't burn out. Okay, good. What else? So we need self-care. The reason we need to be compassionate with ourselves to avoid burnout, to achieve our goals in medicine, right? Medicine is very challenging and but very highly rewarding, but of course it's very challenging. There are a lot of challenges, a lot of hard work, persistence, and we need to pay attention to our well-being as well during this medicine journey. But most importantly, you need to understand we give it to others what we have. So if we are not healthy, if we are not taking care of ourselves, how we can take care of others, how we can have impact, how we can add values in others' lives. So that's the reason we have to self-care. We have to pay attention to our self-care, and I will go over pretty quickly. Self-care has 4 domains: physical health, physical intelligence; intellectual health, intellectual intelligence; emotional health, emotional intelligence; and spiritual health and spiritual intelligence. And all these 4 domains has further subsets, and I will go over pretty quickly. For physical health, I will go over, this is a very good acronym: self, S for sleep hygiene, E for exercise, physical activity, L for learn how to manage stress on daily basis, and F is for food. So make sure you have healthy eating habits and add more fruits, vegetables in your life. So next we have intellectual health. So again, there are 4 subsets for intellectual health: our verbal intelligence, our logical reasoning, our critical thinking, our working memory, and our processing speed. So how we can improve it? By reading, by adding mentors in your life. And these are how we can improve our intellectual health as well. So next, I'm going to talk about pretty quick emotional health. So emotional health, this concept was first time given by Daniel Goleman in 1995. As emotional health, EQ is as important as IQ. So emotional health, again, has 4 subsets. Self-awareness. You should know about ourselves, our weaknesses, our strengths. Then self-management. In all areas of life, we need self-management. Then social awareness. We should know other people's feelings, other people's emotions, how to deal with them. And then most importantly, relationship management. So these all 4 subsets come under the emotional health and emotional intelligence. And last but not least is the spiritual health and spiritual intelligence. Again, there are 4 subsets, our moral values. It's very important. Our ethics, our life purpose. What is the purpose of our life? Why we came in this world? Why we all woke up this morning? We all blessed, right? We all woke up this morning. Many people could not wake up this morning. Our social responsibility around our areas, around our community. So an attitude of gratitude. Always count your blessings. Be thankful for all every day, whatever we have. And of course, we always want to get more. This is a human psychology, we want more, but always be thankful, always have attitude of gratitude, whatever we have, and work hard for more, for betterment for yourself and for others, and make your life easy, and for trying your best to add values in others' lives as well. All right, so just briefly, I talk about the self-care, and now I'm going to go over the case study. So this case study, I would like your participation, and definitely I would like to ask a question, and please feel free to answer. This is the time for you to learn. So please don't feel shy, oh, I will be wrong. No, this is the time to be wrong, and use the logical reasoning, thinking, your thought process, why you think this is the right answer. So let's move over a case study for today. So this is the case study. This is our 63-year-old female with history of hypertension, depressive disorder, and current smoker. So patient smokes every day, about half pack a day. So clinical case after this history. So patient was taking on medications. As I mentioned, patient has hypertension. So patient is taking antihypertensive to control her blood pressure. And that is called ACE inhibitors, called angiotensin converting enzyme inhibitor. This is one of the enzymes in our body that helps, and this enzyme inhibitors called, they're different drugs we use, like lisinopril. And this patient is taking this medicine to control her blood pressure, and then patient is taking for her depression medicine called selective serotonin reuptake inhibitors. This is called antidepressant. So this patient is taking these 2 medications for her hypertension and depressive disorder. So let's move on to next. So this patient, so social history. As I mentioned in the beginning, patient is a current smoker, but denies any illicit drug use. And the patient lives alone, and patient is retired. And family history. So please pay attention to all the history parts. So patient father had a non-fatal myocardial infarction. It's called MI as well. Myocardial infarction is basically the coronary artery disease at the age of 54. And patient does not have any drug allergies. Next, please. So clinical case, after all this history, we do the physical exam. So on examination, it was pretty much unremarkable. And patient was afebrile, vitals were stable, blood pressure is well controlled. Blood pressure you can see is 128/70. And just keep in mind, patient is taking blood pressure medicine. As we talk about angiotensin converting enzyme inhibitor, patient is taking for her blood pressure, and it's within normal range. And respiratory rate is normal range, pulse, BMI is 30. So lab studies, when we check the lab studies, most importantly, we check the lipid panel on her. And lipid panel, total cholesterol level within normal range. LDL is called low density lipoproteins within normal range. HDL cholesterol is called high density lipoprotein within normal range. And when we check fasting glucose it was also within normal range. So lab values, most of them are within normal range. And next, please. So let's a pretty quick snapshot. So this is the 63-year-old female with the routine evaluated for routine examination, and the patient history of hypertension, depressive disorder, and patient social history. Patient is smokes cigarettes every day. Patient family history, father had a MI at age 54. Patient is taking angiotensin converting enzyme inhibitors and antidepressant called selective serotonin reuptake inhibitors. Vitals are stable. So now I want to ask you the question, which of the following components of this patient presentation is associated with the greater risk for an acute myocardial infarction? Myocardial infarction, in other words, called heart attack. So what do you think? So these are all the risk factors. A, current smoking status. B, depressive disorder. C, family history. D, hypertension. E, obesity. So what do you think? Which of the risk factors based on, I can tell you, these all are 5 risk factors for heart attack, acute myocardial infarction, or coronary artery disease. But which one do you think, based on the history, physical, medication history, family history, what do you think is the most likely associated with this patient presentation? So let's see, we got a few responses here. I really appreciate that you guys are participating. Okay, so E, C, okay. Smoking, okay. Asma Chaudhary, okay, good. Ishal, okay, C, okay, good. So as I mentioned, these all 5 are the risk factors, right? So in this scenario, how we can rule out? Why not? So answer is current smoking. So so Asma Chaudhary mentioned smoking, right? So she's right. And so in this scenario, so you have to pay attention. So these are all 5 risk factors for acute MI, but why this patient has a current smoking we have to choose in this scenario. The reason is there's one study called Inter-Heart study. It was assessed by the prevalence of about 9 potentially modifiable risk factors. And in these, the risk factors were hyperlipidemia, called dyslipidemia, smoking, psychosocial stressors, diabetes mellitus, hypertension, obesity, alcohol consumption, physical inactivity, and diet low in fruits and vegetables. So the results of the Inter-Heart study suggest that these modifiable risk factors account for more than 90% of the risk for acute MI, myocardial infarction. So when considered on an individual basis, the 2 most important risk factors were smoking and dyslipidemia. So in this scenario, these 2 risk factors accounting for about 2/3 of the risk for an acute MI, myocardial infarction. So in our patient, when I talk about the lipid panel, the lab studies we did, so I mentioned that it was normal, within normal range. So as this study mentioned, there are 2 main risk factors, 2/3 of the cases were dyslipidemia and smoking. So dyslipidemia has been ruled out because we checked the lipid panel, it was normal. So that's the reason we will choose the current smoking is the reason of MI in this patient. All right, so let's go over pretty quick on the Inter-Heart study. So this was a standard case control study of the acute MI in 52 countries, representing every inhabited continent, about 15,152 cases, and 14,822 controls were enrolled for this study. And collectively, 9 factors accounted for 90% of the myocardial infarction in men and 94% in women. So what is the Inter-Heart risk score? So validating is basically the validating score for quantifying risk factors burden without the use of lab testing. And the scores range from 0 to 48, and with higher score indicating the greater risk factor burden for myocardial infarction. Next, please. So this Inter-Heart study was published, and the 9 modifiable risk factors I discussed before: smoking, low consumption of fruits and vegetables, lack of regular physical activity, abdominal obesity, hypertension, abnormal lipid cholesterol, diabetes mellitus, alcohol consumption, stress. So these are the 9 modifiable risk factors, excuse me, that can cause MI. So these modifiable risk factors we can work on as I talk about a self-awareness. So you can think of which of the 9 factors we already talked about for self-care, right? So we have to take care of ourselves so we can help our patients with these risk factors to help them to modify these factors, right? So there's a reason you can understand how I correlate this self-care with this case study of risk factors for acute MI in our patient in the case studies. So it's very important. So in this patient, how you will manage this patient. So most importantly, educate the patient. What patient is doing? Lifestyle, right? Modification. So what patient is doing? Number one, modifiable risk factor we talk about, smoking, right? So what will we do? We'll counsel the patient, counseling about the patient, about the smoking cessation. Even cutting down few cigarettes a day will reduce the risk of having MI. So, it's sometimes very hard for the patient. So I tell my patients, let's say we got few responses here, weight loss. Okay, good, very good. Yes. So I really appreciate Asma Chaudhary. She is paying a lot of attention. BMI, you see, BMI was 30. Yes. So in our patients, we need counseling education on smoking cessation and weight reduction. How we can do that is again education. We can print out some, of course, counseling takes a lot of time and we have to keep telling the patient. But of course, if I am obese, if my BMI is 30, how can I counsel my patient? So I'm going to correlate again these inter-heart study with our self-care as well, right? If I'm talking to my patient, reduce weight, and I am sitting there in front of her with 30 BMI, what will she listen to me? No, right? So there's the reason you have to take care of yourself as well first. And most importantly, smoking. If I smoke, right, how can I counsel the patient? So always walk your talk, right? So there's a reason I try to correlate this with the self-care and this inter-heart study for the risk factor for myocardial infarction. All right, so this session we set up basically for are again there's non-modifiable risk factors and modifiable risk factors. So again, we talk about the modifiable risk factor, but the non-modifiable risk factors are family history, the genetic makeup, our age is a risk factor, and the gender is a risk factor. All right, so I will stop here, and we have very astute students with us today, and 3 of the students with us today who will have a student medical school interview panel. As we know that this is the medical school interviews session going on, not session, I would say this is the time period where the medical school interviews are ongoing. And these students had already had the interviews. So they will share the experience with you so you can learn from their experiences and it will help you with your interview skills, how you can polish your skills. So it's a great honor for me to introduce for our student panel today. We have Nora, she's a University of Maryland school student. Then we have Hamza, he's from New Jersey, but currently he's studying in Pennsylvania. He will introduce himself as well. And then we have Minahil, she's also University of Maryland graduate. Thank you, everyone. And I'll be with you here during this session. Thank you.
All right, good morning, everyone. Very nice to meet all of you and seeing you today live. So we're going to briefly introduce ourselves, a little bit about me. I graduated from the University of Maryland College Park and recently received a couple of MD acceptances to medical school after interviewing. And a fun fact about me is I truly love public speaking. So I actually did my university's version of TED Talks.
Hi, everyone. My name is Nora. I've actually just graduated the end of the semester from the University of Maryland College Park, also majoring in neurobiology and physiology, with 2 disparate minors in public policy and general business. And a fun fact about me is that I raised birds, I had parakeets, but probably most notable that people know me for are my chickens and ducks.
And my name is Hamza. I'm currently in a 8-year BSDO program. I applied when I was graduating high school in 2021. I'm currently a sophomore there. My major is biology. A little fun fact about me is I've been doing Brazilian Jiu-Jitsu for the past few months, and recently I started kickboxing just a few days ago.
Cool. Thank you so much for introducing yourselves. So a little bit about the timeline at medical school. Essentially, it's almost a year-long process where you take your MCAT, you turn in your applications, your primary applications, and then your secondary applications. And then there's the waiting game that you play with medical schools. Actually, a couple of months ago, we held a medical school application session. We'll also be linking that later in the description of this video on YouTube. But now we're going to be talking about the interview stage after you've submitted on AMCAS or ACOMAS for DO programs. So they usually tend to start anywhere between August all the way till March of the following year that you can start medical school. And the medical school process, of course, we've all been through it. Nora and I, we went through the process. You take your MCAT. We took it actually earlier this year. We were both studying for it. We submitted our primary, then there's secondaries. Now step 4, we're currently at interviews and becoming accepted and deciding with different admission decisions. So it's definitely a marathon and not a race. It takes a bit. This is also another timeline type of question. So I actually wanted to ask Noura, where did you fall on this timeline and when did you start your interviews?
So I'm a little all over the place. I actually took my MCAT a little later than most people would. So I was originally slated for late May, but I had to delay it until I think mid-June. But I hesitate to say like it's okay to delay it. You should only delay it if you know that you'll benefit from it. And I knew that I would benefit from it, and I did. I did really well on it. As far as the application goes, I submit as early as possible. For me, I had to delay because I had to wait for my MCAT score. So my primaries ended up getting submitted, I think, in like early August. And then I started hearing secondaries. It depends on the school when they send out secondaries. For me, some I received immediately, others took a little while. And that's kind of where I was in terms of like the application. My interviews, I started hearing back from as early as November, because some secondaries I submitted a little later than I should have. And don't worry if you submit later, because it is possible to get your interviews, because it's rolling admission. So like, keep that in mind as well.
Thank you, Noura. And as for myself, I applied on the second day applications opened, so on June 1st, and I was able to interview in September. So there was a little bit of a delay between June to September. It was a waiting game on finding out, if medical schools liked me enough or not, and it was definitely a waiting game. So, in the meantime, you can always submit update letters if you're working on different updates or you've had different publications, you've had any recognitions. These are all great update letters to send, and it doesn't hurt to send them. There tends to be a little bit of back and forth on how effective they are for medical school applications and admissions decisions, but at least it shows schools that you're interested in them, especially with the number of different schools that you're applying to. I think that the average number of medical schools that pre-med students apply to is 17 when I Googled it last time, but it can be anywhere between, 15, 10 to 15 to even up to, I know some students have applied to at least 30 or 35. So, we've all gone through this process, leading up to the interview. We've had all these different clinical experiences where, you're super passionate, you're writing about it in your applications, you've gotten people to review your personal statements. And this accumulation of experiences has led to getting your foot into the door when you finally get invited to an interview. In fact, there are a lot of statistics that show, medical schools have very limited interview spots. So when they provide you an interview, that shows that they're interested in your written applications and written materials, and they want to find a reason to accept you. And that's something that's super important to me. When I was preparing for my interview, I was feeling like, sometimes there tends to be feelings of imposter syndrome as well. Why would they pick me among thousands of other applications? And that's because you had a standout application. There was something in that application that stood out to them or the school's mission or values. So I want to go a little bit over different types of interviews. Medical schools tend to have these three main types. There tends to be a traditional interview, which is a one-on-one between 30-minute to 60-minute conversation with a faculty member or a student who is currently enrolled there. There are also group panel interviews. Hamza, I believe that you've had a group interview. Can you tell us a little bit more about that?
All right. So in a group interview, for me, it was for Nova Southeastern University's Kiransi Patel College of Osteopathic Medicine interview, right? And for me, it was personally a bunch of high schoolers because we were doing a BSDO interview. And what happened was on Zoom, we had about 5 or 6 people along with the interviewer from the school together. And what would happen is that the interviewer would ask us questions first individually just to get to know us, get to know our background, get to know why we're interested in medicine. And then he'd have a bit of an open floor. So, for example, he had us discuss the current American medical system. So we're talking about, would Medicare for all be better, or would having the current system be better, something like that. And everybody had their input to put in and to talk about, what they think would be best. You should be bouncing off other people's ideas or mentioning your past experiences, things like that. That's how it works.
Thank you so much, Hamza. And one more different type of interview is called the MMI, a multiple mini interview. This was actually introduced from a Canadian medical school called McGill University. And I think American medical schools kind of took that idea and started presenting ethical scenarios, and you have 1 or 2 minutes to prepare and talk about them. So they really depend. I know that back when interviews were in person, I watched a couple of videos where they've talked about they hire these actors or patient actors or even ethical scenario actors who present a case to you or an ethical dilemma, and they ask you to respond as though you are in that case itself. And that's very similar to the Casper exam. If you've heard of it, some schools require it. The Casper exam is this ethics test that Nora and I also took. It was very interesting, where it's very similar, but it's a recorded video response that you're giving because it's an examination. But an MMI is live, and you're with a person, or it could also be over Zoom now. Because Nora, was your interview in person or virtual? Because mine were virtual this year.
Mine was virtual. Sorry about the jostling. The cat's attacking my laptop.
It's totally fine. I like seeing the tail of the cat. It's walking around. It's also learning how to get into medical school and how to interview as well. It's working on its interview skills for sure. So I want to switch gears a little bit and kind of go into the shoes of the interviewer. When you finally understand the psychology behind what they're looking for, it helps a lot in preparing and reducing the anxiety and stress. But it is really important to note that each medical and professional school is different. Interviewers are looking for very different things, and sometimes they're instructed to look for very specific qualities and traits. But I've heard that interviewers, these are the common themes, but let me revisit that after. This is a different order. So if I'm an interviewer and I was looking at an applicant, if I was interviewing with Nora, for example, or Hamza, I would imagine them while they were giving me their responses. Is this someone that I would go to for professional help? Could I picture this individual taking care of my own family members? Are they exhibiting the traits of compassion, empathy, respect? And would I actually want them to treat people of my own blood, of my own family? That's how sincere this individual is, if I would trust them to be willing to take care of my family members or myself. And also, we have all these written materials. They also want to see that do you match what you're on paper? Do you match these wonderful, wonderful clinical shadowing experience that you have? And if you're able to articulate that well, do you match the image that you show in your applications? Are you honest? Do you match this on paper? And, especially since they do a lot of criminal background checks as well. In fact, I've heard that they also check if you've had any parking tickets, speeding tickets. It's very interesting. And sometimes they ask about it during interviews. And I know that during the application, they ask you if you've had any misdemeanors or felonies or any cases of any things that happened during college. Finally, if I was a student, I'd also be thinking while I'm interviewing someone, if this is someone that I can actually live with, and would this person really fit into my community? Do they communicate well? Are they stable or self-confident, motivated and self-motivated? And finally, what's shadowing all about? Ultimately, so that you could become knowledgeable of the demands of this profession and how you can meet them, and if you can rise up to those challenges. And that's why we have all these virtual shadowing sessions, so that you can kind of get a look and peek into what a life or a day is like in the day of a physician. And finally, they want to see if you're interesting. I know when Nora and I were preparing for our interviews, we were kind of panicking, like what differentiates us from the thousands of other medical students out there. But I want to ensure and want to really encourage you and let you guys know that you're really just competing with yourselves. Understand that there will always be someone with a higher MCAT or GPA than you. Ultimately, if you keep that mindset and you're competing with others and you continue to do that, unfortunately, that leads to burnout, and it doesn't really make you feel that good about comparing yourself to others. But rather, if you can compete with yourself and be the best version of yourself, challenge yourself, that way, you know that you are an interesting person because you're exploring experiences that you're interested in, and you're pursuing what you're passionate about. In undergrad, it's very hard to make time for things that I know that when I was in high school, I was in many different clubs because I had that time. But when I started undergrad and college, I could only pursue things that I truly cared about and I was truly passionate about. So that's how you can ensure that if you're an interesting person or not. Ultimately, we're all very unique. We're our own little snowflakes. We all have different DNA. We're all different. And the reason why you were different is why you were selected for an interview. And it is a process. If you're still waiting for an interview right now, keep persistent, stay consistent, stay in touch with the admissions committee at that school, and you can try contacting them if they allow it. And sending in update letters never hurts. Noor, if you have anything to add to this, what were your thoughts when you were preparing for your interview?
So one thing I'd like to share is I'd like to reiterate what you're saying, that when you get the interview, that means there's something in your application that they loved about you and they want to have a reason to accept you. Don't go into it thinking like, oh God, they're just looking for a reason to reject me. That'll just stress you out. For me, at least, I know that really helped me a lot, especially since I get nervous easily sometimes when there's like high stakes in these things. But one of the biggest tips I would give you is to make that interview your own, because if you go with the mindset that they would just want to accept me, then just go into it like you're going to talk to your parents or something, or like someone that you're really close to you, like that you can share anything with, because they're not going to grill you aggressively on like those one-on-one interviews. Maybe the multiple minute interviews, because they're going to ask you for ethical considerations. But the best thing you can do in that situation is be honest, because what is honesty but another important aspect of your ethics. So don't worry too much.
Thank you, Nura. And I have the slides backwards, but I also wanted to touch a little bit on common questions and themes. I know that in all of my interviews, these are the top 10 questions that I received. Every time they would ask, sometimes they'd ask, of course, why medicine? And that's what your personal statement answers. And I know that we sometimes feel off guard that why are they asking us again, even though it's in our written application, written materials? It's because they want to see that you match what you're on paper. So you need to know your personal statement inside and out and be able to reiterate it in a more animated way and not like as if you're reading your personal statement, because they have it in front of them. They want to see how you talk about it, how you see it, and what your tone of voice is. That's not something that you can see on paper. And that's the whole purpose of these interviews, to see that you're a people person, that you have the emotional and social intelligence to be able to build a rapport with the interviewer. So a couple of themes that I had specifically, when I think about this bullet point, the specific questions about experiences listed, it depends on the school. So I had one rural medical school in West Virginia. They asked me about my experience at shock trauma in Baltimore. She was an emergency medicine physician, and she asked that about my specific application, because all my experiences have been in the city and urban areas. And because her experiences were in the rural areas, and she's heard a lot about the shock trauma center, I was able to talk a little bit about that and increase her knowledge about the shock trauma center, because it is a sort of, it would be rare for someone from a rural area or rural and underserved medically area to be able to experience a shock trauma center. Whereas when you live in Maryland, we tend to take it for granted, because it is it's a very nationally recognized system. And so that's just one example. So even if it's something different from what you'd expect, because I wasn't expecting being asked about that. I was asked about a couple of times with different interviewers, but their recurring theme was it was based on their school and what their school's mission and a culture was like. So their culture was more so more like rural or primary care focused. They'd be asking me questions about the opposite sometimes, or sometimes because a lot of my materials would emphasize the rural and medically underserved, and that's why I was matching. You can tell why I was matching with those schools. Another question that comes up is like, do you have any questions for me, or is there anything that I can bring to the admissions committee? That tends to be the concluding and final question. And this is the time when you have the final way that you can leave a lasting impression on your interviewer. I know that when you're asked, do you have any questions for me, we tend to panic. And of course, I feel like pre-meds know now that we need to ask a question. That's how you show that you're interested in this position. It's a universal rule across even job applications or any type of interview. It doesn't necessarily have to be specific to medical school interviews, but you need to cater it to your audience. If it's a student asking you, you're not going to ask them, so what's the residency program like here? Because they have not experienced residency and they're still a student or a medical student. So always cater your questions to the audience that you have. I had one interviewer who's not even a medical physician. She was a psychologist. So and she told me she told me in the beginning, I cannot answer any questions about the curriculum because I'm not affiliated with the medical school as a professor. So I had backup questions because I was prepared that, we would maybe have a medical physician who would be interviewing me, a student, or even a non-physician, a psychologist, which is very interesting because they're also on the admissions committees. So always be prepared for these different types of audiences that you may have, and cater your questions to the school and what you're genuinely curious about. And Nura, what did you ask your top medical schools?
So I don't remember the questions exactly off the top of my head, but I also prepared a list of questions. I also made myself formulate questions that were important to me for each school. So like when I selected schools, I had reasons for picking them, but then there were some things that I wanted to make sure each of them had as well, based on what I wanted. So I prepared questions based on that. That's a great way to prep as well. I also separated them by exactly how you suggested. Would I be talking to faculty? Would I be talking to a physician or non-physician? And would I be talking to a student, and where in their journeys in medicine, or were they in like first year, fourth year? Because there's a big difference between a first year medical student and a fourth year medical student. So that's kind of how I prepared my question.
Thank you, Nura. And I actually put down questions in the chat box. Like that's kind of how I differentiated my questions. That was just my list that I copy pasted from just now. Like to ask students, like, what are the lectures like? Do most students attend lectures? Are they mandatory? What are the hours like? Every medical school is very different. For example, University of Maryland School of Medicine, they only require you to attend small group discussion activities, and lectures are not mandatory, which means you only need to attend medical school for 2 hours a day. Whereas some other medical schools require you to attend from 8 a.m. to 5 p.m. and it's mandatory every single day. So it really, so you need to also understand the type of learner that you are, and you know, it's both ways. When you're in an interview, they're interviewing you, and you also have the opportunity to interview them and get to know them and see if that, and check out if you're also the best fit for them. So we went over this slide. All right, so I wanted to switch gears again and talk a little bit about best practices when preparing for an interview. So just in general, before I get into the nitty-gritty points that I prepared, Hamza, what are some best practices that you can think of when, as a high school student? Because I know that some pushback I've heard about BSMD and BSDO programs is that how does a high school student know that they want to commit themselves to a very long and arduous profession, because there are some undergrad graduates who also, you know, don't tend to know. So it's very impressive to be accepted into medical school as a high school student. So if you could tell me a little bit more about that, and if any interviewers asked you why medicine, how did you answer that question?
Right. So some advice I was always given was, don't just say the generic, I want to help people answer, right? Because that's an answer that they're going to expect from everyone. Everybody's going to say, I want to help people, so that's what I want to do medicine. You have to explain as well, like you have an interest in the science behind, you have an interest in the human body, something about medicine. So for example, maybe the problem solving, maybe trying to figure out what is wrong with the patient. That's what makes you interested. And you also have to mention you have some kind of experience as well. You can't just go into this program without any experience at all, right? You have to explain, I volunteered here, I did some shadowing there. That's where I got some experience working with patients, and I really enjoyed that time. Or that's how you would at least make it known that you genuinely are interested, and you look that way towards your interviewer. Another thing to mention is that they also want to know that you did research. So obviously I'm in a DO program, right? I went to 2 DO programs. I'm going to mention this a little more when I get to my slides, but always do proper research based on, what the field is like today, rather than what the field was like, 50 years ago or 100 years ago, because they want to know that you're genuinely doing research about how the field is, not just, propaganda coming from one side or the other. Like I had one point, so usually for osteopath medicine, people say that the osteopathic field is more holistic in their approach. They look at the whole patient and whatnot. The issue is that all doctors do that, whether they're allopathic doctors, osteopathic doctors, everybody does that nowadays, right? The only difference at the time was a long time ago. But still, you had people during that group interview say, oh, I wanted to be a DO because DOs are more holistic than MDs. That would be an insult to, an MD who might be interviewing you, right? So make sure to do your research and make sure that you genuinely have an experience to actually show them that you are interested in the field, and it's not just like, I want to do this because I can.
Thank you so much, Hamza. That's exactly right. When you were talking about up-to-date information, there's a reason why that's so important, because when you're in the field, when you become a physician or a PA or a nurse, anywhere in the medical field, things are advancing very rapidly. Research articles, and in fact, there's an app that physicians use called Up to Date, and it helps them stay up to date. And that's so important, that you should know the differences in licenses. Or I know in the past, DO programs may have been different, but now they're very similar to MD programs. And I want you to touch a little bit more on the differences between them when we get to your slides. So that'll be interesting. So a few practices I thought about. Let me just get oh, there we go. So number one, when you first start off, understand that when me and Noor were talking about the timeline, we may have applied in the summer, and now we're interviewing in the winter. So it's been at least 3 to 4 months since we submitted our applications. That means that we might not remember everything that we wrote. And I remember I had an interview a couple of days ago where I did not remember at all what I wrote back in June. So I had to refresh my memory. I had to reread my entire primary application, start to finish, page 1 to page 22, and read my different experiences, because all of it is fair game. So you need to remind yourself so that you don't seem like, oh, I don't remember that experience. But when you reread your application, you should also feel inspired again, because I know I felt very inspired again. I was like, oh, so this is why I revisited medicine. That's also why your medical school application is so important, because it's not just for the medical school, it's for you as well. So you can reread it anytime later down in your medical career, understand why you pursued this profession to begin with. So when I reread my primary and also secondary application, secondary is meaning the school specific questions, that I was also questioned on that, and I'll be honest, I didn't fully prepare for the answers that I gave them. I didn't remember reading it fully, my secondary, so I should have done that. And if I could go back, I would do that again, because there were some ideas that I put down that I didn't fully remember. So I had to quickly pull it up because it was a virtual interview. I was able to do that. So remember that you can still quickly, open up your applications again, even during the interview, if you're not remembering something. So that's also a good tip I had. During my interview, I also had little sticky notes on my laptop because it was virtual, and I had a couple of bullet points, like why medicine, my 3 bullet points, of course not scripted, but at least these 3 main points that I want to get across to my interviewer. Number 2, research the school. Hamza, you were talking a little bit about that, on understanding the mission, values, and community of that school. The best way to get to know the community of the school, if you don't know someone who's already a student there, look up their website and faculty websites, check out, see if they're a research focused or intensive school. There are a lot of forums on Reddit and the Student Doctor Network that also tell you exactly what these schools are looking for and what they emphasize in their missions. Of course, they're all medical schools, so they are all degree granting institutions that will make you a doctor eventually, but they differ a little bit on what they emphasize. Some schools emphasize primary care, some schools emphasize research. So you need to understand that mission and values stuff. Also, when you're filling out your secondary application, schools also provide that to you right before the interview. So it's good to familiarize yourself with it and see how you can fit into that mission. So remember, it's a two-way street. When you're interviewing, it's back and forth to see if you would also be a good fit at that school. Next, mindset. Noor, you talked a little bit about this mindset, where schools are actually looking for a reason to accept you because interview slots are so rare. I can give you an example. At one medical school I know of, there were 7,000 applications last year. They only gave 500 interviews and accepted 250 students. So that means that once you are interviewing, your chances to get accepted become exponentially greater. They went from 3% to 50%. So it becomes a 50-50 shot, or usually sometimes higher. Once you go into that mindset of, oh, they've given me an interview, they're interested in me. Now it's time for them to get to know me a little bit better. And finally, mock interviews. So Hamza and Noura, did you guys participate in any mock interviews when preparing for your interviews?
Yeah, I did. I had my father and my uncle help me. They would ask questions. So a lot of those questions you actually had listed on the previous slide, they had, along with some other questions. They left out a lot of the more specific questions, like about, things that a high schooler wouldn't understand. But they still quizzed me. They made sure I could properly answer like the main core questions, like, for example, why do I want to do medicine? Why did you choose this school? Those kinds of things.
Yeah, I also participated in mock interviews. I was also lucky that the school I went to provided mock interviews if you went through their admissions services. So that one was probably the most helpful because I had an actual medical student who's conducted interviews before for the school ask me questions. Another thing I did was similar. I had my family ask me questions. I had a list that I had prepared because if you, like Minahal mentioned, there's like other resources that might like have an archive of questions that the schools asked before an interview. So I just handed them those and they just started asking me the hardest ones. And then they would just give me tips on where to improve.
So the recurring thing I'm seeing is that you had people who you trust, like family members, interview you, and also people you don't know also interview you. Because I had a couple of mock interviews of people who never met me before, and that's very important as well because they don't have the bias and they're meeting me for the first time. So I mock interviewed with people I had never met before at my career center at my university, and my wonderful like health professional advising office. They also provide mock interviews. And also I would just ask myself these questions randomly during the day when I was preparing for my interview. It was like, how would I bullet point this in my head? I didn't want to type out my responses because I felt that you can ad lib it as you go along. It's very important to make it into a conversation and not sounding super scripted. For example, a lot of us tend to be asked, tell me about yourself, but sometimes they don't ask us because we tend to over prepare for that question. So when you're telling, like that's a very golden question asked across all interviews, like tell me about yourself. It's better to have bullet points rather than written out sentences, because then it tends to start to sound scripted when you're doing your mock interviews. And I know that when I was mock interviewed, my first mock interview with someone I didn't know before, she was a current medical student. And when I answered this question, tell me about yourself, I made a mistake. I started selling myself. What I mean by that is I started saying that my name is Manahil and I started this organization and I'm super excited about this school. So I got too excited. They're going to ask me about my extracurriculars later on in the interviews, but it's really important to note that they're asking you about yourself as a person, what they couldn't find in your application, what wouldn't be on your application. So instead, what you could say is, I'm a daughter, I'm an eldest sister. These are all personal traits. And if you're a family person, it shows that you're a family person. So I said that instead in my actual interview. And that worked out very well because my interviewer and I connected very well on our shared love for our families. So always ensure. So I think that's a really important point, that you shouldn't sell yourself immediately, because they're going to get to that. They're going to ask you the rest of the questions during this traditional interview. They've read your application. Sometimes they haven't. And that's a different topic on the different types of interviews, like blind or non-blind. Blind interview means that that the interviewer has actually never read your application before and doesn't know and maybe might not even know your MCAT or GPA scores. So that actually helps reduce the bias towards you as an individual, because you've already been screened, and that foot in the door concept of you've gotten your foot into the door, now you just need to be able to be personable enough to be accepted. And finally, during the interview, learn about your interviewers and have a conversation with them, as I was saying before. And these are a couple of resources that I had here, but we're going to review that later on. But yeah, Hamza, take it away. Feel free to talk a little bit more about, for our high school students here. I know that we emphasize a lot with undergrads, but if there are also some high school students here. So if you could also touch a little bit on how to get into medical school when you're in high school.
Right. So I don't know how many high schools there are here. I don't know if they're on the YouTube or on the Zoom, but for just to explain, a BSMD or BSDO program means Bachelor's of Science / MD, Doctor of Medicine, or DO, Doctor of Osteopathic Medicine. So I won't get too much into the specifics of this degree, but these are 2 degrees that can both practice medicine. And this is an outline to getting accepted, right? Or at least just doing the process. So when you're in high school, you want to prepare for college, right? This is similar to what you do when you're in college yourself, except the difference being that you don't take specific classes, right? Some classes can help. Like, for example, I took anatomy and physiology during my senior year, but you want to focus on your GPA, make sure to maintain your GPA, make sure to get a good SAT score, and make sure to have your extracurriculars in line, right? All 3 of these things are very important, right? They all work together to help you with getting into your program. So after that, right, or during that same period of time, you'd also want to do research, right? Find out about what schools fit you and what you can get into. So this is generally about colleges, right, or universities rather than medical schools at first. Because, for example, if you have like a GPA of 3.3, you're probably not getting into Harvard, right? And I don't even think Harvard has a BSMD or BSDO program. But look at the schools that do have these programs. Look at what fits you, what gets in the range of what GPA or an SAT you have, right? And apply towards those schools and start doing research with those schools. Find out about their culture, find out about, what the students are like. And if anybody wants to add something, they can go ahead.
Yes, Hamza, I would like to introduce, first of all, it's a great honor for me to let you know that we have our medical director, Dr. Asma Chaudhary, with us, live with us. And she she went to med school here, and she would like to share her experience, and she will tell you more about it. And let me see, Dr. Asma Chaudhary, please go ahead.
Okay, let me see if I can you guys see me?
Yes, we can.
Okay, give me 1 second. So I was not prepared to talk today, but I'm really happy to come on because I have been listening to all of you, Manahil and Nora and Hamza, and I'm really impressed. Wow, the quality of the applicants just keeps going up every single year. I'm really pretty impressed by this. Let's see. I think I'm having trouble with my video. Give me another second. Let me see. All right, let me try one more time. Can you see me?
Yes, your camera's just flipped around.
It's flipped. Okay, so you can see my house. Okay, there we go.
Yes, there we go.
Can you
Now we
see me
can
now?
Yes.
Okay, so this is, true Dr. Saturday doing CME and drinking my second cup of chai and enjoying listening to all of you. I went to medical school a long time ago. I've been in practice for quite a while, and I really am enjoying listening to all of you youngsters as you go through the process. So many things have changed, but the core has remained the same. And I want to just add a few insights that I think may be helpful to some other people. Somebody mentioned imposter syndrome. I think that was you, Manaho. And I think for highly motivated type A personalities who at this point in our, stages have been competing to try to get ahead, imposter syndrome is very common. It's a natural thing. And it can work for you because it can be very motivating and it can help propel you. It can also work against you if you allow it to. And I wanted to add a few insights. This area where I live, so I'm in Virginia, and this sort of greater DMV area, DC, Maryland, and Virginia, I would classify as a pretty privileged area. But I did not grow up in a very privileged area. I grew up in Georgia and in a county that didn't have the best schools. And I went to a normal school, and then I went to a state university because they gave a full scholarship. So I didn't go to a very, fancy university. And I really felt like I had the imposter syndrome because you would see people applying, they were from Harvard and they were from Brown and they're from Cornell. And you think, what do they want from little old me who went to Georgia State University? And I think it's very important that they want you. You have to understand that you don't have to be at the fanciest school and you don't have to have all of the things, but you have to have some things. And one of the things that you have to have is this internal drive, because that's not something that you just get. You have it, you cultivate it, you work on it. So you have to have this drive. And secondly, you have to have a good GPA. They're not looking at your GPA based on where you went to school. They're looking at your GPA as a number. And if you are a person who really has a hard time with competition and doing extra work, remember that the high name schools are going to do a lot of weed out classes. Your GPA will be less. But the admissions committees are not going to say, well, they went to Harvard, so let's let this GPA slide. That's not what works. So I will say that you don't have to have the best of everything. You do need to have a good GPA. You need to have an internal drive. And you have to remember that we can see privilege too on admissions committees. I'm much more likely to be interested in a person who had to put themselves through school while maintaining a GPA than somebody who went to a fancy school and didn't have to do anything. So there are multiple ways to get in, and don't rule it out. If you're not in a fancy school, it's fine. I think you still can, you have a lot to offer, and medical schools want to hear from you. And you got to work hard. I will also say that train yourself to sit and study. There's hours and hours of studying. And Dr. Chima in the beginning mentioned self-care. Self-care is so important. And by this time in your life, you know what brings you joy, right? If it's brisk walk, if it's playing tennis, if it is doing yoga, if it's meditating, but you have to cultivate that in addition to your studying habits. So I would just say that so much has changed, but the core has remained the same, that you have to have a strong work ethic. And when you go into the interviews, don't be, especially if it's a group interview, don't be taken aback and timid, and don't be afraid of what other people are saying. Everybody might sound better than you, but they're still interested in you. And, you know, I worked in high school. I had a job. And do you know, I had group interviews and they asked me about my time working in a diamond store. That's what they were interested in. And guess what? I got into the schools that I wanted to go to. So you can have all of these experiences in the medical field, but then you can also be working at a diamond store to make money and still get into med school. And that's not a reflection of your abilities and who you are. So I want to say that for the people who might be listening to say, oh my gosh, I don't have this and I don't have this and I don't have this. You have something and you have to figure out what it is and cultivate it, and don't downplay it. Make that the focus.
Thank you so much, Dr.
Thank
Jyoti.
you.
That
Thank you,
was
Dr.
very-
Smachodi. I really appreciate. And thank you so much for joining us this Saturday morning.
This was such an amazing thing. And I think the people who are listening to this, really, it gives you an idea of how, you know, amazing the candidates are, Manahil and Hamza and Noura. I know you guys have worked really, really hard, and now it's the time to exhale and enjoy a few months before medical school starts. But it's a lot of hard work, and you have to have your ducks in a row. But at the same time, you don't want to lose your humanity. And one other advice that I'll give, because now I'm an old lady, and now in retrospect, I can tell you what really worked for me, was don't listen to the people when you start medical school, because all of you that are really interested, eventually you'll get in. It might take a year, it might take 2 years, but if you're really interested, you'll get in. You need to, don't be impressed by the people who will try to make you believe they're doing things they're not. Oh, either they'll say, I didn't study at all, or they'll say, I pulled an all-nighter. Don't be one of those people. Prioritize your sleep, prioritize the good habits, wake up early and study. And I have found that for me, my success was in waking up early and using those early morning dawn hours before anybody else was awake to do my studying. Find what works for you. And kind of, you know, my father would tell me to put on blinders. You're in a crowd and there's all these people to your left and your right, and there's all this white noise. They're going to tell you what they're doing and what they're not doing. You just put on blinders and focus. And for me, what really worked was waking up early every single day. And I felt like I had a lot more freshness and blessings in the day. I could work so much better. Find what works for you and do it. Put your blinders on.
Thank you so much, Dr. Smachodi. I really appreciate it. And I second the early morning hours. There's a proverb, early to bed, early to rise, makes a person healthy, wealthy, and wise. And you can see Dr. Smachodi giving us so wisdomful advices and share the experiences. I really appreciate. And
thank you. Can you guys hear my birds? I wanted to let Noura hear my birds. Can you hear the birds in the background?
Yes, she just
Okay.
stepped away because her birds were bothering her, so she had to drop for a second. But I will tell her about your birds.
Yes, my songbirds are in the background singing.
Oh, great. So which birds do you have, Dr. Smachodi?
We have song canaries.
Oh, okay.
Yeah,
So,
and the males have a beautiful song, and you can probably hear them right now as I'm singing. When the sun comes up early, they wake us up, and they're beautiful. It's nice to hear them.
So that's why you're an early bird too. So you put
Yeah, I'm early bird. Early bird, but on my second cup of chai, which you guys will understand.
So how many cups of chai you take every day?
Just one, really. Occasionally two.
Okay.
Yesterday was a busy day.
That's acceptable. That's acceptable. I really appreciate it.
Thank you for having me.
Thank you, Dr. Smachodi. Definitely, please feel free to share more thoughts. And we have a few more minutes left. And pretty quick, someone asked a question in the chat box. What about the old international medical graduates? Dr. Asman, do you have any advices for the old international medical graduates? It's tough. It's very tough.
Old is a state of being, right? You know, in my medical school class, we had somebody who was 50 years old, and this was like a second career. And my father went to medical school in his 40s after he had 4 kids. So I don't even like to use that as a gauge. Where there's a will, there's a way.
Right.
You make it work. My dad in his 40s went to medical school and then did a master's in public health to get a residency. So, and that's part of the reason that I didn't feel intimidated, because I thought, you know, if my father can switch his career from engineering to medicine in his 40s with 4 kids, what excuse do I have? He made it, he normalized changing your mind and pivoting careers, but he never compromised on hard work. So I don't think there's any issue here. If you are a foreign medical graduate, there's a lot of foreign medical graduates that I work with on a daily basis and mentor. I have one coming to see me mid-December. She's going to be doing an elective with me. Because it takes, you know, you got to hustle. You got to hustle. You got to make yourselves known. You have to do the work, participate in research, get those good scores. Where there's a will, there's a way. My aunt also was a foreign medical grad, came to this country, had 3 kids, raised her 3 kids, then went back and took her USMLEs, did her residency. She was in her 40s. So it's possible. You just have to have the will for it. You can do it.
Sure, thank you. And I would like to share my experience. I'm international medical graduate, and of course,
Right.
persistence. Yes. So definitely, as Dr. Chaudhary mentioned, persistence, persistence, persistence. When there's a will, there is a way. So always, as all international medical graduates, all on, please, it's again, as Dr. Asma Chaudhary mentioned, internal drive. How much you want, how much passionate you are. But of course, I took my exam exams and I had 2 kids. I think one was 6 and another was 4. 2 toddlers running around me and books. So I know it's a struggle. Of course, there's sacrifices there as well. But if you are really passionate about it, you can do it. So I always, yeah, go ahead.
And just speaking on yours, I did not have children when I was in medical school. And I sincerely respect the people who did. And I will tell you very clearly that the ones that were older or who had families or who had children were such champions of time management. They excelled and did better than the rest of us. So it is sometimes not a weakness, but it is a strength, because you have more experience, you lived more life, and you know how to manage yourself better than somebody who's in their 20s. So I would focus on the strength of what you have learned over all this time. I don't even say the O word. What is old, right? You focus on what you've learned during this period, and then you apply that, and you have advantages that others may not have.
All right, thank you. This was a question asked by Deeps in the chat box. So I hope we answered your question. She said, thank you. All right, thank you, Dr. Chaudhary. I really appreciate that.
Thank you.
Yes, it's all, again, as Dr. Chaudhary mentioned, internal drive, your passion. I always say your passion and profession should be the same. So when you have same passion and profession, then you are not working a single day. Even you can ask Dr. Chaudhary, she loves work, going to work every day. Like when we love watching some movie, so 3 hours, 4 hours just pass by in a few seconds, right? So that's the way when you love your profession, so I don't say work-life balance. I say everything. I love it when we love it. So again, I will ask Dr. Chaudhary as well to talk. This is our last slide as well, keys to success. So be comfortable with the new. Leave the comfort zone. I think about more than 7 billion world population, we are living in the comfort zone. So we have to come out of our comfort zone and learn something new and be comfortable trying something new. Be comfortable having to try something new. Give over the resistance to change, because we all want to stay in our comfort zone and we feel scared. We get apprehended. What will happen when we come out of our comfort zone? So please try to get over the resistance to change. So always have a growth mindset. Even I think every day I learn. Even I learn from 5 years old. I have 7 years old at home. I learn something every day new from her as well. So always have an open mind to learn, like kids, right? They'll always be willing to learn. So always be open to learn something new every day. Have a growth mindset and be optimistic to make a change. And self-growth is very important. And again, we talk about persistence and grit. And again, passion and profession should be the same. So I would like Dr. Chaudhary to give a few tips for success as well. I already mentioned a lot, but give a couple of few more words for you. We really want to learn from you as well.
I would just add that, persistence and grit is really important. And in the beginning, Dr. Chima, in the beginning of this session, you spoke about self-care and self-awareness. I think that is so important because when you are a high-achieving individual, failures can seem devastating. And perfection is a goal that we're used to achieving, but that's not reality. And as a physician, we have to hold ourselves to very high standards, but it's important to lean into feelings of failure and to identify how that makes you feel and to work harder next time. Some of the people who had the greatest difficulty were the people who did not allow themselves to fail. The most high achieving individuals, when something went wrong in medical school or post medical school life and residency, would have the hardest time. And I teach this to my children too. Failure is where all the learning happens. You don't learn when you're constantly achieving, and happy, those hours and hours of studying. That may not give you as much learning time as what failure and disappointment. And if you have a failure, this doesn't mean that you're not going to be able to succeed. It means that this is an opportunity for you to learn and to propel yourself forward with the things that you have learned. So there's a balance here. You have to have grit, you have to work hard, but you also have to completely feel the failure and allow yourself to fail at things. This might mean that you got a low MCAT score and you're going to be really upset about it. And then you're going to change things. You're going to modify things. You're going to take it again. This might mean that you didn't get into medical school the first time or even the second time, but you're going to feel those feelings. You're going to make changes. You're going to modify things and you're going to do it again. So, I will say this, that in my life, nothing has taught me more than the times I failed, and I continue to fail, 10, 11 years into, work in my professional life. And we tend to measure ourselves by what we got right, but at some point you learn that most of your learning happens when you didn't do something right, but you really can't fall apart. And that's part of what emotional intelligence is, to know that you had something, you didn't do your best, you're going to make some changes and do better. So emotional intelligence is really important, and it will help you not turn into a basket case if things don't go your way.
Thank you. I really appreciate it. Yes, I would like to add on, when there are failures or setbacks, so think about it, what happened. As some student mentioned, that it's a failure is first attempt in learning. So always, of course, take some time, think about it, what happened. And the reason I think we feel like we always are looking for an easy way to achieve a result, but nothing worthwhile can be achieved easily. So everything worthwhile requires a long period of hard work. Persistence, great, and along with many failures, but learn from the failures. That's the main thing, as Dr. Chaudhary mentioned as well. And there are many failures along the way, but learn from it, move on, and attempt again, learn something new, and you will achieve your goals. Thank you so much.
Thank you so much, Dr. Chima and Dr. Chaudhary, for this incredibly informative and mentorship and teaching session. I love everyone to please give a warm thank you to Dr. Chima and Dr. Chaudhary in the chat box for this incredibly informative session. We really appreciate your time. Thank you so much. Now we're going to be moving on to our session quiz and future session dates. So the link to the quiz is now live. It's based on what we discussed about this during the session, whether it be interview skills or the case study that we went over, and it's on there. We will also be hosting a pediatrics course and a couple of sessions as we take a winter break for the next 2 weeks. So because of final exams, students have given us the consensus that it's better that we have our next live session on January 7th, and we'll open up the previous sessions during winter break so that you can receive certification for any of the quizzes that you may have missed. So this date will also be on our social media outlets as well, so be sure to follow us at TeleShadowing. Thank you so much for attending today's session. I know I learned a lot. We hope to see you in upcoming sessions, and this concludes this week's shadowing. Thank you.